Ritesh. Welcome to this conversation. We are talking to the Managing Director of Optum Global Solutions India Private Limited. Thank you so much for joining us as the head of one of the largest healthcare companies, global healthcare companies, that is probably the Fortune 10 or Fortune 15 companies, in the world. And there's tons of experience I think you have from your organization when it comes to healthcare delivery and improvising healthcare delivery for the populations across the world. Healthcare has always been an important topic, in the history of mankind. But I think the last 2 years have been extra special for all of us when I think we have been hit by something which is at a global scale, right? I mean, never in our lifetime we have never seen or imagined anything like that, and hope we don't have to face that thing again. But nevertheless, having faced the reality of what happened, there are a lot of things that came out, a lot of learnings came out of it. Healthcare has never been, it's never been a thing which has been equitable, or which is there's always been room to do more in it. Whichever part of the world you are in, there's always a scope to do more. But I think I'd like to hear some of your ideas around, what are the things, where were the cracks, or where are the learnings that came out of this COVID-19 experience in the last 2 years, which you believe need to be addressed, globally, I would say, because this has been a global issue.
Well, first, Sanjeev, thanks for the warmth of your welcome. I appreciate, and I am looking forward to this conversation. Fortune 5 when I last checked, so that's where UHG is. But coming to your question, I think Sanjeev, let me start by saying that there will be a time for us to look back and dissect what we did right, what we did wrong as a global community. I think for now, let's look at the practical side of what has happened and what's going on. I think obviously, Sanjeev, there are many things to talk about where the health industry went through, from the start of the pandemic, where the virus was first identified, to its detailed DNA analysis, to the rush to find vaccines, and frankly, the rush to get vaccines to the right people. Were we equitable there? Did everyone get the right share of vaccines? Don't know. We'll find out. We'll probably do an analysis at the right time. All the lockdowns, the maskings, and then the unlocking and the unmasking and back again. Did we get it right, Sanjeev? I think time will tell. But I think you raised the right problem. You raised the right question. So if you look at the central problem of healthcare, it's around access, affordability, and quality. How do you get, this is what we call the triple aim. How do we get all three right at the same time? I think that's the central problem of healthcare. And Sanjeev, as you can well imagine, this is nothing to do with the pandemic. This existed pre-pandemic. What happened is, post-pandemic, once the pandemic happened, this became like a major conversation, on WhatsApp, in your living rooms, on the TV. So this has become very visible and apparent. But this issue, as you rightly said, was always there, the issue of equity and so on. So the three issues, access, quality, and affordability, how do you get all three right at the same time is the challenge. And, for example, the other practical thing, Sanjeev, I can talk about is, with the pandemic going on right now, a lot of us don't feel comfortable going to our primary physicians for a checkup or for some kind of a non-critical issue, right? So overnight, what's happened is a huge adoption for digital health solution is happening. So, which means a large segment of the population, I can certainly vouch for in the US, but I think globally, even in India, we're seeing are rushing to and are receiving care online for the first time, right? Like a virtual visit. And the interesting thing is, once this has happened, people actually like it. And so what's going on, Sanjeev, right now is providers, payers, regulators, regardless of which country, are having to respond quickly to make things to meet the rising need challenges. And I don't think this is going to go away post-pandemic. So this is here to stay. And another example, that I would like to stop at, and again, a very practical one is, a lot of us have been involved in the health and wellness issues for a long time. I mean, for example, I particularly have been very interested in wellness issues and so on for a long time, nothing to do with the pandemic. But what's happened now is, because of the pandemic, we are making active decisions every day that affect our healthcare and our wellness. We are actively researching. We now know the sites. We go look at it. So what's going on, Sanjeev, is I think the consumerization of healthcare has, I feel, through the pandemic, been accelerated. And because of both the things I said, now digitization and consumerization, I think the future post-pandemic will look very different from what it was pre-pandemic. Although the underlying root cause is still the same, it's still the triple aim. But I think different forces have been set free in this pandemic that will mark how the future looks. And this is, again, globally, but certainly in India, when I turn on, everything I said is absolutely true in India as well. I mean, I'm sure you've experienced it. I certainly have experienced it too.
No, thank you. No, you're right. I mean, things are changing in a significant way, and last 2 years have been, I think, never been a time when we've seen change in every field, but more so, of course, in healthcare. And one of the things that has been talked about in India and globally is about this digital healthcare. The digitization, as you also mentioned, has been one of the factors. How do you see a role of digital coming in this? Because in a country like India, especially when you mentioned about accessibility, affordability, these factors, and there are areas that we have also been trying to see, how do we get access to remote areas of the country at the cost which they can afford, that is a key factor. So,
right.
What is your view on this digital health, and how do you see the future of that, and what are the things that came out especially during these times last 2 years?
Well, first of all, Sanjeev, as a technologist, this is really exciting for me. I mean, I can barely sit in my chair when I speak about these things, because this is really exciting. This is, what happened to the retail industry, 15 years ago, and the health and the financial services 10 years ago. I think a lot of those trends are starting to play. But, healthcare is unique at the same time. One of the biggest trends that's going on, and is, probably not so apparent to everyone, but this has been going on pre-pandemic as well, is that the center of gravity of healthcare is slowly moving out of a hospital and much closer to our homes. Think of it that way. 10 years ago, 15 years ago, healthcare, most things you would rush to a hospital. But slowly, it's the center of gravity is moving closer to home, and that's where digitization and consumerization plays such an important part. That's why you're seeing all of these, RX type of, delivery firms, drug delivery firms, and so on do so well, because, as I said, the care center is moving home. And in fact, I was reading an article where, one of the leading management consultants said that globally, the use of telehealth is 38 times higher than it was pre-pandemic. So 38x. And they surveyed, and they said about 83% of the patients that they spoke to now want to use, telemedicine as their go-to medicine, going forward. They don't want to go to a hospital or a dispensary or something and expose themselves to unnecessarily exposure. So not only has this brought in a whole new population into telehealth, now that they've experienced it, they think this is a good channel they want to continue. So that's a big one, right? The next thing that is, again, not so commonly observed is the focus on and the uptick on mental health, and that's become a very central part in this whole pandemic that needs to be observed, and also the uptick of what I call digital therapeutics. So in other words, app-based therapy, where you can interact with your mobile phone and get feedback in real time, and so for mental health situations, this is actually extremely important. And how do we as technologists combine the healthcare factors with the ease of use and the digital media? I think that's a very exciting interface that is now evolving, and we have a big role to play in it. We as technologists who are interested in healthcare have a very, very, very big role to play in it. So these are, I would I would say, some of the examples that are less observed, but I just want to say that at Optum or UHG, we are actually at all sides of this opportunity. We are building out the plumbing that enables the provider assets to be instantly online and ready for digital services. On the other hand, we are preparing our own physicians and clinics to be ready for telehealth, and also we are leading the market and actually creating telehealth-led health plans. And that could be, almost 20-30% cheaper than a traditional plan. So we are, all over these opportunities, but, the opportunities are immense and very exciting.
Absolutely. I think you mentioned it right. That care is coming to home also. And you talked about the rise in the telehealth, that definitely we got to see. And then there are too many opportunities that are in front of us as a large company, and where I stand corrected as a Fortune 5 company. You play in lots of parts of the healthcare delivery. So you have a pretty well-rounded view of this. Just looking at it from the insurance side, looking at it from the delivery side, operation side, technology side. Where do you see an opportunity for healthcare delivery organizations, where they can do the most? There are too many things they can do. There are quite a lot of things they can do. But if you have to pick up 2 or 3 big things, that low-hanging ones that they should focus on, and more so in, I would say this part of the world also, their conditions are slightly different. What would those couple of things would be, in your opinion?
I think the process of digitization, there are similarities with other sectors, and that's so interesting for me to observe. How do you? So for instance, a few quick things to point out. First, like in any other digitization process, you have to start with building a data-driven map of influence. That's what we call it. You have to understand the full context of a consumer's environments, the social structures, public and organizational data, look at health literacy, look at digital access, what are some of the social determinants that impact digital engagement and outcomes. So build a whole map of what's going on. Then once you've built a map, you have to pick a specific area to intervene in. When I say intervene, what it means is, maybe pick an area where there is a prevalence of low health engagement, some poor quality outcomes are happening, a lot of diabetic patients and so on. Then you prioritize, and once you've decided this is the segment I'm going to intervene in, you have to prioritize your activities. Okay. And in order to prioritize your activities, you have to obviously know your population that you want to engage, and you have to meet the consumers where they are. For example, what are some of the real life challenges that they're facing? What are some of their barriers, to interact with digital tools the way you want it to be? And then once you know that, you have to address the root cause. So for example, is language a barrier? Do you have to use local language instead of English or some common language? Do you sometimes have to use big visual icons instead of a lot of English? And those barriers are very important in a healthcare-like structure where you need quick input and you need it to be clear, right? You can't be ambiguous. So once you've addressed all that, then you can, the last thing there I would say is the last mile, which is you, in the end, no matter whether you're Fortune 5 or Fortune 1, you have to build a community. You have to live in an ecosystem, and to reach the end consumer using your digital tools, you have to reach them where they are, and with the help of a whole community of people.
So thank you, Ritesh. As you talked about, the areas, there are so many factors that impact the digital delivery, digital adoption among the masses, or the areas, or the geographies that we are talking about. As a technologist, as an organization, also, there's a lot of focus for you to develop a lot of technology solutions and products. What is your view how things are going to shape up in the healthcare industry? What are your focus areas, as an individual or as an organization? Not any confidential thing, but as a larger, broader, perspective of it.
Yeah, I think the reason I feel for technologists, healthcare is actually very exciting, is that we are experiencing it every day, with us ourselves, with our loved ones, so this is a well-established, we all go through, health issues, we all experience it, and we all have opinions on it, which is great. I mean, so when we start as a technologist, when we look at healthcare, the number one thing I would urge and I recommend that we start with is a patient-centric approach. Because we all are patients in our real lives. So what does a patient-centric approach in technology terms mean? A, can we start anticipating what the patients need as opposed to responding to them afterwards? So can we start anticipating, a priori? Second, how can we build tools to involve more and more the patient herself in her own healthcare journey? So that's the second part that I think is very important, and we are working on it. And I think technologists can actually help us here. And then obviously the third thing that you and I talked about, which is what is the most convenient location of care? For my older parents or grandparents, maybe they want to stay in their houses and live as independent a life as possible. How can we provide them the tools, the sensors, the ability to do that, and not have to move somewhere else that they don't want to? That's what I call a patient-centric approach, and how technology can actually start anticipating patients' needs even before they arise, and sort of and therefore address them in a much more convenient location, as opposed to then post-accident somebody fell down and then they're having to go to a hospital. That's much worse. So a patient-centric approach to healthcare, that's number one. At the same time, I think a provider experience is very important. What I mean by that is the most sacrosanct thing in healthcare, Sanjeev, as you know, is the relationship or the connection between the patient and his doctor. How can technology make that connection, enrich that connection, so that the doctors can then spend the time during that meeting on what's most important, which is listening to the patient, and technology can provide everything else. They can start looking at the patient's history, start looking at connections, basically start providing the next best course of action while the doctor interacts with the patient. I think that's another area where technology can really help us. And finally, where does all of this lead to? Why anticipate patients' needs? Why? So all of this would lead to healthcare becoming much more affordable, Sanjeev. And that's the underlying thing, because at the end of it, we can keep making, wonder drugs, but if they cost, 10 lakhs, then not many people can actually use them, right? So how do you create all this in an environment where you also make it more affordable? To give an instance, I gave you the example of older people. If they can live in their own surroundings, it makes things so much cheaper and better, because then we are anticipating, we are warning them, that you may have forgotten to take your drug, or your vitals tell us something is wrong. Can you, do a telehealth call with a doctor, or send a nurse over when we suspect something is wrong, rather than something, goes wrong in a bad way. So those all bring down the cost of care. Can we, steer a patient to more affordable generic drugs? Can we, provide drug interaction information to doctors in the right time as they're prescribing their medicines, so that they can avoid mistakes? Because mistakes in healthcare are very expensive. Those are ways that technology can create, patient experience, can create provider experience, and bring down healthcare costs, all three at the same time, which is the holy grail of healthcare.
No, you articulated it very well. We are talking of a change of paradigm, getting healthcare to where the patient is, bringing technology assistance in the patient-doctor interaction, both in terms of, which will improve the time spent, in a much better manner. On doctor can focus on things which he really wants to focus on, as well as you said, cutting down the cost when it comes to prescriptions and so on. So absolutely, I think this is the way, the direction in which we are headed. But the thing is, these are all we just started moving in that direction. All this will require a lot of innovation. That leaves room for a lot of innovation in this field, right? And the good thing is, I mean, the part of the world we are in India, we see USA anyway has been there, Europe has been there all along, and China has been there. India is now counted among the top 3 when it comes to startups, the innovation, and the type of solutions we need is also a little different from maybe the rest of the world. So there is a lot of room for innovation here everywhere, right? And that's where I would like to hear some of your thoughts. How do we spur more innovation in this direction? I mean, how do we bring out more newer ideas into this? It's a very regulated field. Healthcare is a very regulated field, right? And at the same time, we need a lot of innovation. So how do you see this for us to, or especially in your organization like yours, helping this innovation and people who are developing newer solutions?
Yeah, Sanjeev, that's a great question, and I'd love to sort of steer the conversation and end it with the people. The reason we have 31,000 employees in India and that we operate in India at such large scale is the quality of talent, right? Let's remember that that's the main reason we are here, for the quality of talent. And that's, you asked a question about innovation. We really believe that you need the talent, you need to bring in. So our best technologists, Sanjeev, today, are employed in, let's say, for lack of a better word, social media, right? Where they are helping social media interaction, or retail, where they're, making products more sticky and so on. These are great examples. But imagine them working in healthcare. Imagine the number of lives they could touch and how they could change things dramatically, bringing in the knowledge that they've developed in other fields and then bringing it into healthcare and understanding healthcare better. I think that's where innovation comes from. Getting ideas from outside in with the basis of talent that you have here and build on top. And that's what we are so excited to say, that these 31,000 people, I think we should be at the forefront of healthcare IT, of healthcare technology, and building this out. But Sanjeev, I think at the same time, I think healthcare is not that well established as a technology area of expertise. And I hope this conversation and other conversations like these help, even if it creates a question in the mind of 10 people to say, maybe we should look at healthcare for our next challenge. That would be great, because if you want to apply yourself to really complex problems that can, pretty much actually in the right word to say is save lives, healthcare is the only place where you can do that. And there are opportunities now, and as we discussed, technology is coming to the forefront, and that's where India has so much to offer. So it's a great place to end on innovation, on people. But that's why we are having this conversation, and that's why UHG is so big in India and so bullish on India, because we believe great things can happen, not just with the talent, but also with the ecosystem, with the schools, with the IITs and the IIMs, with the talent coming through from these schools. How can we develop labs here, build ecosystems with some of the health tech startups, and solve for problems in a more generic or better way? These are all areas that we are exploring to say, how can we make innovation the reason we are in India?
Thank you, Ritesh. I mean, that was, again, well said when you talked about innovating, for an impact, innovating where, of course, you make money and you grow as an organization, but also get a satisfaction that, you actually change something on the ground level. And that's, and fortunately, we do see a lot of innovation in the healthcare happening. We have opportunity as an organization to work with hundreds of healthcare organizations or startups. We have even taken some of the solutions and deployed them into rural areas also, where trying out, what impact they can make at the ground level also. So being, heading one of the largest healthcare companies in India, what is advice you will give to these innovators, apart from the fact that, they are doing great work and they've chosen the right thing. Any final word for them, because I think your word will mean a lot to a lot of these young entrepreneurs.
Well, no, I think I've said enough, but I think the one thing, from my personal life experience, I can tell them is, to be more thoughtful and conscious about the choices they're making, early in their careers. For example, money versus mission. I'm not saying it's versus. I mean, we all want money, right? But then the question comes, now versus later. Do we want something now, or do we want a lot later? These are conscious choices, and we have to make those with our full thoughts and minds, right? And I think that's what will, in the end, differentiate a very good career from a great career. And I also believe that, the mission matters. What you are doing with your time matters, because you have a finite time in this world, and therefore, which wall you lean your ladder against is as important as how quickly you climb the ladder, right? So I believe the mission part is very important, and that's where, in the end, I'll say healthcare offers a fantastic vision. And to do your life's best work, I think you have to look at healthcare before you look at something else. These are things I would offer as suggestions to young technologists making their careers early in their lives. I hope that they go through these, they make conscious choices, and then they learn to live with it.
Right. No, thank you so much, Ritesh, for joining us in this session. We had a chance to cover lots of topics ranging from digital technologies to innovation, and how we can apply some of that in addressing some of the areas, not only in India, but at a global level. A few things are going to be common, a few things are going to be unique in India. We look forward to interacting with you again in other programs, given the organization that you had and the wealth of experience you bring at a personal level also, with your wide-ranging experience in the industry. So look forward to engaging with you further in other programs. Thank you so much, Ritesh, for joining us.
Thank you, Sanjeev.